Hi, it's Amy Flory from Core Balance Therapy, and today I'm going to talk about two insurance things that are current as of today. Today, number one, being the last day that you can sign up for healthcare insurance through the healthcare exchange. So if you are already on a healthcare exchange plan, if you're going to keep that same coverage, you don't do anything, but you do need to sign up today if you don't have coverage already. If you don't sign up by today, then you do have a penalty this next year. And if you have pre-existing conditions, then you really do need to have healthcare insurance through the exchange. Insurance bought outside of the exchange does not necessarily cover for pre-existing conditions. So the second thing that I wanted to bring up for today is a bill that is up before Congress and the Senate called the Medicare Access to Rehabilitation Services Act, House of Representatives Bill 807 and the Senate 253. And what this has to do with is the cap that is put on reimbursement from Medicare for Medicare members having therapy services. And the cap has been in place since 1997. It was put into place to help balance the budget, but the formula for calculating how much money and services the Medicare members should get was faulty. It was known at that time, and every year, except for maybe 2 years since 1997, so 20 years, maybe 2 years, there has been an exception put in place. And the exception is needed for people who have had one major thing go wrong in their physical life or several things going wrong over the course of the year. They would very quickly meet that cap. So every year around this time there is a bill being passed. It takes a literal act of Congress to allow for exemptions for the next year. Sometimes that hasn't happened by December 31st, and then the following year it's a big mess with Medicare having to reprocess claims. It's very expensive because the exception process almost inevitably gets put in place, and it's chaos for providers and patients and Medicare for 6 months. So this is the first year, I think, that there's actually a bill put in place to repeal the cap permanently. And that's what this bill is called. That's what it's meant to do. Because this, the way they do things accounting-wise, the cost of this bill is put in terms of the lifelong cost of the bill. So it's in the many billions of dollars, which is why there has really never been enough political capital to try to do this in the past. So if you are on Medicare, you know someone who's on Medicare, this is an important thing for many of our Medicare patients to be able to go past the cap. It costs a lot of money on the part of Medicare for processing these types of things, and time on the provider's part for putting in the codes and assessments and reporting regarding meeting the cap. And now the requirements of the Affordable Care Act require a certain number of visits for physical therapy, that the cap in place is actually lower than that. So without the exemption, Medicare is actually in violation of the Affordable Care Act. So there will most likely be an exception. It's whether it's going to be a 1-year exception at a time, as it's been for 20 years, or permanently repealing the cap. So if you have any questions, just drop us a line. We'll go ahead and post a link to the Patient Action Center. If you click on that, it'll take you right to a script for an email and who your senator and representatives are that you can contact regarding this. But please do so well before December 31st. If it's not in place by December 31st, then it's a problem. So Again, let us know if you have any questions about that. Thanks a lot for your time. Have a great weekend, and we'll see you next week.